Hi, everyone. Thank you all so much for being here. My name is Clara. This is a Medicaid 101 and Medicaid Introduction to Medicaid HARP training. We're really excited to have you all. As you can probably see, as you've been joining, this meeting is being recorded, and we are going to be starting our Facebook live stream in just a moment. So just so everybody's aware. My name is Clara, and I'm going to be kind of hosting and moderating this event. As I said, we are going to be recording, and the Facebook live stream will be starting. Has just started. So hi, everyone from Facebook. Thank you for joining us as well. We are going to give folks another minute or two to join in. We know there's always something, Zoom trouble, internet trouble, and all of that. But I do want to let everybody know that we do have ASL interpretation and Spanish interpretation available. You should be seeing the ASL interpreter Francine spotlighted. That we also have ASL interpreter Genevieve. We're going to be spotlighting the active interpreter throughout the presentation as they change places. And I'm going to put that in the chat as well. Para hispanohablantes, por favor, hacen clic en el globo en la parte inferior de la pantalla y seleccione español para oír la interpretación en vivo en español. Y si necesitan ayuda, por favor, piden ayuda en el chat y yo les puedo ayudar cuando termino la introducción. Y también es necesario, le ayuda a tocar donde dice silenciar audio original para solo escuchar al intérprete. Again, so thank you, everybody, as we are starting up. Okay, I know we've still got a couple of folks kind of joining us, but I do want to get started just for the sake of time. I'll be repeating this again sort of as I go through my introduction, but please do, I see a couple of folks have introduced themselves in the chat already. I love that. Please continue to say hello, say where you're joining us from. I will be moderating the chat. We are going to be saving Q&A for some designated Q&A periods throughout the presentation, but I will be keeping track of questions. So if a question does come up in the chat, I'll be making sure to keep track of that for our presenter. Okay, so I'm going to just say NAMI-NYC is the National Alliance on Mental Illness of New York City is the host of today's event. We're doing this in partnership with the Urban Justice Center Mental Health Project, and we're really excited about that. So I'm just going to say a few words about NAMI-NYC, and then I'm going to turn it over to our speaker, who we're really pleased to have here today. NAMI-NYC, again, the National Alliance on Mental Illness of New York City, is a grassroots mental health organization. Our mission is to provide support, education, and advocacy to individuals and families impacted by mental illness. So what that means is that we have free, currently virtual, hopefully soon in person, classes and support groups for people living with mental health issues, and also for anybody supporting someone living with a mental health issue. So we have classes and groups for people living with mental health issues and for family members and friends, anybody who's a support to someone. And all of our classes and groups are facilitated by volunteers who themselves are either living with a mental health issue or supporting someone who is. So when we say that our services are peer-led, that's kind of what we're referring to. You can find out more about all of our services by going to our website, which is NAMI-NYC.org, and that's going to be popping up in the chat any minute now. You can also call our helpline. That number is also going to be in the chat, but I'm going to say it out loud for anybody who may be listening in and not have access to the chat. That number is 212-684-3264. And you can also email us at helpline@NAMI-NYC.org. Okay, so I could definitely say more about us and our services. And I see that there's a lot of folks in the chat who are joining us from different organizations. So we're really excited to have you all here. But I do want to leave plenty of time for our speaker. So I'm going to introduce our speaker, Frankie, and then pass it over to them. So for this conversation, we're really honored to welcome Frankie Herman, who is the Medicaid coordinating attorney for the Urban Justice Center Mental Health Project and lead coordinator for the Access to Recovery Coalition, which is hosted by the Mental Health Project, and which you're definitely going to be hearing more about. Frankie lives with multiple mental health concerns and is queer and non-binary trans, and themselves was on Medicaid and successfully kept their Medicaid through representing themselves at a Medicaid fair hearing. So we are really grateful that you're sharing your personal and professional expertise with us. And I'm going to pass it over to you.
Thank you so much, Clara, and thank you everybody for joining us here today. As Clara mentioned, my name is Frankie. So today we're here to talk about Medicaid 101, Medicaid HARP 101, and if that acronym is not familiar to you, don't worry about it, we'll get into it, and the Access to Recovery Coalition, or as we call ourselves, A2R. So the goals of this training today are to just understand some of the basics of Medicaid and Medicaid HARP, to understand what supports or services might be available to you, and to understand who to go to when you have a question or a complaint or a concern, if you need an advocate for your situation, or if you want to connect with others to make the Medicaid system easier to access. I will be going through quite a bit of material. Like with any presentation, some of it might stick, some of it, most of it might not right away. But as Clara mentioned, we are sharing the slides afterwards, and this is being recorded. So you'll have those references available to you, and I have some contact information for you throughout the presentation as well. Anything else I'm forgetting before I move on? Nope, I think that's it. Okay, so I work for the Urban Justice Center Mental Health Project. We are a nonprofit. We are physically located in downtown Manhattan, but have been working remotely for the last 2 years or so. We advocate for individuals who live with serious mental health concerns, and we believe we approach this from an anti-oppression standpoint. We believe that low-income people who have mental health concerns, we're all entitled to live stable and full lives free from discrimination. There's some more information for you here if you want to look at our website. I won't go into kind of all the details of what we do, but I am your trainer today. My name is Frankie Herman, and I am the Medicaid coordinating attorney. If you want to reach me individually after the presentation, my information is right there. Email is the fastest, but phone calls work too. Okay, so Medicaid 101. So first of all, what is Medicaid? Medicaid, it's a public health insurance program. It is the money to pay for Medicaid and Medicaid services comes from the federal government. It also is pitched in by the state government and local counties. So what that means is Medicaid is unique in each state. The federal government oversees and sets some rules that every state has to follow, but then the state can add some additional services, and then the state is responsible, in addition to the local counties, for administering the Medicaid program. So some of you might have also be on or have heard of Medicare. They're not the same thing. And some people have both. And when people have both, that's called dual eligibility. So we're not going to go into a lot of details about Medicare today. We're talking about Medicaid, but just some basic differences. Medicare is a federal program, and it is funded fully through federal money, versus Medicaid is federal, state, and local, and unique to each state. There are different categories for how people become eligible for each, and differences between kind of like what the resource limits or income limits might be to be eligible. So resources would be something like what you already have in your savings account, right? That's a resource. There's limits on that for Medicaid. Unlike Medicare, there's no resource limit. Income limit would be something like if you are working a job and you receive a paycheck, that would be income. Medicare has more limited benefits versus Medicaid, at least in New York, has more expansive benefits available for folks. So who is eligible for Medicaid in the state of New York? You have to meet all of the following criteria. You must be a resident of New York State. You have to have adequate immigration status. You have to meet the income limits, and you have to meet the resource limits. Within Medicaid, there's a lot of different kinds of Medicaid. So what the immigration status, income limits, or resource limits are will depend on your specific situation. So how do you apply for Medicaid in New York? There's two different sets of rules for two different sets of populations. I'm going to present this visually, and then the next slide I have it written out, so it's presented in two different ways. So for individuals who have low or no income, who are under 65 years old, and using the language that Medicaid uses, are not disabled or blind. Those individuals would apply through something called the marketplace. Some people might know it as New York State of Health. They're the same place. It's just there's two different names for it. And in order to apply, you can just call the New York State of Health, also known as the marketplace, at 1-855-355-5777. And for our listeners, that number is on the slides. So when we share those with you, you'll have access to that number as well. You can also apply online. The other group of folks are people who, if you don't qualify for that first type that I mentioned, which is also called MAGI Medicaid, or that stands for median adjusted gross income. So people kind of call that MAGI versus if you don't qualify for that kind, you might then qualify for this other kind, which is for people who are over 65 years old or are disabled and or blind in the language, in Medicare language, or sorry, excuse me, Medicaid language. The way that you apply for that would be through your local county. In New York City, it's called HRA, or Human Rights Administration, sorry. I speak in acronyms all the time, and sometimes it gets even a little bit lost on me. For if you're not in New York City, then you would apply through your local district social services. And I have on the slide here, there is a website you can go to click on that, figure out like what the phone number is in your particular county. So saying that all again, but just in a kind of a written format, there's two sets of rules for different populations. There is what's called the marketplace or New York State of Health. Generally, that's for people who have no income or low income, who are under 65 years old, and in Medicaid language are not legally disabled or blind. There's rules called the modified adjusted gross income. Those are the rules they use. And then I have the phone numbers again for folks to reach out. If you think that you don't qualify under that, but you think you might qualify under this other one, in New York City, you would contact Human Resources Administration, and outstate, you would contact your local county. That other one is generally for people who do not qualify for the first one, but who are legally disabled, 65 or over, or are blind. They use a different set of rules. Gets kind of into like that income and resources. The income and resources is different for different folks. So now I've said all that, and what if you're reading this or listening to me and saying, what? There's a phone number you can call. So if you're not sure which group you might fall into, you can call the Medicaid helpline, and they will assist you with figuring out which group to fall into, where you need to apply. The Medicaid helpline is 1-800-541-2831. There's also a website that you can go to if that's your preferred method. And that, again, is both of that number and the website are on the slides that we will be sharing. So once you've applied, you then, and let's say you're determined to be eligible, you might fall into one of two categories of a type of Medicaid. One is called Medicaid managed care. The other is called fee-for-service. Some people know it as straight Medicaid. Medicaid managed care is the most common type. Most of the state of New York is trying to move, the state of New York is trying to move most individuals into managed care. Some people still qualify for fee-for-service. It's a very small group of people. But what's the difference between these two? So really it has to do with who is administering the plan and who is getting paid to administer the plan. So in managed care, like I mentioned earlier, with Medicaid, money comes from the federal government, and then also money comes from the state government. That money in managed care then goes to a managed care plan. So some examples of a managed care plan would be like Health First, Affinity, Metro Plus. Your insurance company is another way to think about it. And the managed care plan and the insurance company are kind of are the same thing. And then the managed care plan would then pay the providers versus in fee for service, the money still comes from the federal government, still then gets added to by the state government, but then the state government, without any managed care plan, just directly pays medical providers. So managed care plans will have things like a network of providers that are within, like Affinity, you can see X, Y, and Z doctor, but at Health First, you can only see A, B, and C doctor, that type of thing. With the fee for service, there's no managed care involved in making decisions about whether or not you have access to care, and it's just one less layer of bureaucracy. However, for better or for worse, there's arguments both ways. Most people will have Medicaid managed care if you have Medicaid. So whether or not you have managed care or fee for service, there are certain services that Medicaid will cover. So it sort of doesn't matter which group you fall into. These services, if they're authorized and if they're medically necessary, and I'll explain what those mean in a little bit, include hospital treatments, prescription medications, outpatient treatment and preventative care, transportation to outpatient medical appointments, mental health care, including substance use disorder treatment, crisis respite, which is a voluntary short-term residential treatment program, durable medical equipment, for example, a wheelchair, Hoya lift, something like that, long-term support, such as a home health aide, a personal aide, and nursing home care, limited dental and vision care, physical therapy, and diagnostic tests. Now, these have to be authorized and they have to be medically necessary. So what does that mean? Authorized means that the service has been approved by either the managed care plan or by the state, depending if you have managed care or fee for service. So if it's managed care, the managed care plan approves it. If you have fee for service, then the state would approve it. And medically necessary, they use kind of like this long list of things. That is typically where people find themselves in disagreement with their care. This is usually where a lot of the problems come up. So medically necessary, according to the Medicaid managed care model contract, is healthcare and services that are necessary to prevent, diagnose, manage, or treat conditions in the person that can cause acute suffering, endanger life, result in illness or infirmity, interfere with such person's capacity for normal activity, or threaten some significant, in their language, handicap. So what I usually see with individuals who are having a problem getting services authorized is that the managed care plan will say the service is not medically necessary. That's a very common thing that they just kind of spit out, to my mind, without even really looking at the individual situation. And so if you ever receive any paperwork like that, one tip is to save any paperwork you receive from your insurance plan in one folder. And if there's any paperwork that you get that denies you something, that is reducing your services or supports, or that is eliminating it, immediately call an advocate, because there are some time-sensitive deadlines in which I find it helpful to have some guidance on what to do and what steps to take. So if you have, and I'm largely going to be talking about managed care as that's most of what folks have. But again, if you have fee for service and there's questions about that, we'll have contact information and you can reach out. So when you have Medicaid in New York State, you'll get a benefit card. You can see there circled in red would be your Medicaid ID. If you're ever calling about anything related to Medicaid, someone's going to ask you, what's your member number? What's your Medicaid ID? What's your SIN number? And that number is right there under the big B of your benefit card. It will always be 2 letters, 5 numbers, and 1 letter. So that's how you'll know that that's your Medicaid ID number. If you are also in a managed care plan, I've got some examples of managed care plans here, their cards. Some managed care plans will have their own member ID, but they will be able to find you based on your Medicaid ID. So that's the important one to always be able to have on hand for yourself. So let's say you want to find a doctor or a specialist. You need some type of service that you believe Medicaid, can pay for. What you'll want to do is contact, if you don't already know, you'll contact the member services number on the back of your managed care card and ask the representative to help. So I'm just going to go back to that first screen. The managed care card is the one that says like Emblem Health, United Care Health, Metro Plus, Empire, or something. That will have a member services number on the back. That's the number you want to call, not the New York State benefit ID card. So they're two different things. You'll want to call the managed care plan. They'll know who's in network for the particular plan that you have. So a tip is they can look up the doctor, specialist, phone number for you. They're not going to know anything about the actual doctor. So if you're calling and saying, is this a decent doctor? Is this person well reviewed? They're not going to know anything like that. They're just representatives that look up in a directory for you the type of specialist or doctor you're asking for. However, you can ask for somebody in an area that's convenient for you, someplace you work, socialize, live. You'll give them like an address or your zip code and ask them to find you somebody close nearby so that it's convenient for you. If there is already a doctor specialist that you like, you want to see them, maybe somebody recommended them to you, you can call their office and ask their staff to check and see if that doctor takes your insurance. The doctor often themselves do not know what kind of insurance they accept. It's typically their administrative staff that's going to know this information. So you want to talk to the front desk staff. And then if you need to see a specialist, your primary care provider, so that would be like your family doctor, the main doctor you see, the first person you see that's listed, typically can be listed on your card as well. We'll say PCP, that stands for primary care physician. Normally you'll have to see that doctor before you can see a specialist. So you'll want to make sure that you get that referral. So like I said, often you will need a referral. For most specialists, you're going to need a referral from your primary care physician or else Medicaid won't pay for it. You can call the member services number on the back of your card and ask that representative, do I need a referral for this particular thing? So if you're not sure, you don't want to waste your time going to a primary care physician, if you could just go directly see somebody, you can contact the member services number on the back of your card and ask that representative to let you know. There are some things where you do not need a referral. So for example, once every 12 months without a referral, you can get a mental health assessment, meaning you can go someplace and ask for an assessment like a therapist or a psychiatric office. You can get a chemical dependence assessment for inpatient detoxification, inpatient rehabilitation, or outpatient detoxification. Under Medicaid, once every 24 months without a referral, you can schedule an eye exam, and that will include a pair of eyeglasses. Or if you need OBGYN services, you want to see a midwife, or you need a breast or pelvic exam, those are things you can schedule directly without requiring a referral. And of course, emergencies. So if you need to call 911 for something, those you do not need a referral. So examples are heart attack, broken bones, loss of consciousness, when you feel you might hurt yourself or hurt somebody else. Okay, so let's say you're going through this and there's something comes up. You need a referral, but you can't get one. Or you got a referral, but Medicaid won't authorize the service, anything like that. If you have questions, or there's just something in this presentation that I just said and you need some clarification. If you have questions, if you have an issue, if something went wrong, let's say you went and called the representative and they told you the wrong information and you want to file a complaint about how that service went, or you just have a concern, you can contact our office. So our office provides free and confidential information, advocacy, and legal assistance for your Medicaid related needs. The way that it works is we'll have a discussion with you. ask you to give a little bit of a detail about what's going on. If we think we might be able to take your case, we'll do an intake with you and kind of proceed to next steps from there. Regardless of whether we can take your case or not, we always try to find a referral for you. So if our office isn't able to do the work that you need assistance with, we will try to find you a referral. And for people listening, I'm going to say a phone number, but again, these are also on the slides. So you can reach us at 646-459-3076 or HARP@urbanjustice.org. Okay, so now I'm going to pause for, we can take 10 minutes for any kind of like questions, clarifications, or feedback about what we just talked about.
Awesome. Thank you, Frankie. So there are a couple of questions that were in the chat, and I'm sure that there will be questions coming up in the chat. And also, if folks want to say their question out loud, if we have time, I can also, you can raise your hand, and I will try to keep track of those as well for folks to unmute themselves and ask the question if that's easier than putting in the chat. So the first question, jump around a little bit. Is there a comprehensive list of what are legally recognized to be disabilities for the purposes of for Medicaid purposes?
That is a great question. I'm not as familiar with the, I don't do applications a lot, so I'm not as familiar with that. But to my understanding, oftentimes what's used is the SSI, sort of like qualified disabilities. So either if somebody has already got that paperwork and they can show that they were found disabled by the Social Security Administration, or if they can show, you know, comparable conditions.
Cool, great, thank you. And can you talk a little bit about sort of, there was sort of a broad question about, you know, mental health issues being eligible, and sort of like how broad that eligibility is, like how broad the how broad the categories of like what is considered a mental health issue is considered for the purposes of Medicaid.
How broad is it considered? So mental health concerns would be something like PTSD, generalized anxiety disorder, schizoaffective disorder, but not things like autism or what are kind of in their language considered intellectual or developmental disabilities. But that said, that doesn't mean that there's not services available. So if you have a question about, if you want a referral to something that's specific to your situation or that of a loved one or a neighbor or whomever, you would want to contact your primary care physician and discuss that question with the individual and see what kind of referrals that you can get for that particular situation.
Cool. Who pays for these services after a referral, the MCO or Medicaid? It's an interesting question.
It gets a little bit into the area of Medicaid budgeting, which I am not an expert on. However, the managed care plans, to my understanding, receive a rate regardless of what services you do or do not use. So they get paid no matter what, which I think is a lot of why people start seeing a lot of rejections.
Gotcha. Yeah, actually, on those lines, this may be a very specific question that you might need to sort of refer someone to get additional sort of advice, but this might apply to a broader number of people. There is an ASD coach who said that if I have Medicaid, which I do, that it would pay for their services if they became a vendor with whatever organization provides the funding. How do I do that?
So that I think would be a great question for somebody to contact me directly about, so I can get into the details. But broadly speaking, Medicaid managed care plans have their network of providers, and they have their things they pay for and their things that they just don't. If somebody has a medically necessary service that they're seeking, and Medicaid would pay for it, except that um, the specialists that they have in their network don't cover that. Like, they don't have a broad enough network that somebody is not included. Then there's something called a single case agreement, in which they can do a one just for that individual with just that practitioner, an out of network agreement. So that's something that I would recommend contacting an advocate and getting more specific kind of details about what the possibilities, is this a service that's covered by Medicaid, first of all? And if it is, and the issue is simply that that person is outside of network, then there's some steps that individual can take um, to pursue getting coverage for that particular specialist.
Perfect. And can you repeat, someone had asked about this, can you repeat the different avenues for finding an advocate? I know you shared the HARP, the Mental Health Project number, and I put that in the chat as well, but were there any other resources for finding an advocate that you can repeat for folks?
Yeah, so let me just kind of go back here. I would recommend just contacting us, and then depending on what specific advocate you're looking for, we'll give you a referral if we're not somebody who can assist you. Because there's other organizations, there's CHAMP, there's ICANN, there's NILAG, there's a lot of different organizations that do provide these types of services. And we, these are our colleagues, right? So we all work together to make sure that the community's needs are being met.
Perfect. There's a bunch of questions that came in. I think we'll do one more. And then I think we can, there will be, I think, several other options to ask questions. So I'm going to just keep track of them. But someone was wondering if there is any assistance with finding living facilities, rent controlled apartments, low income housing. The person didn't say this, but maybe supportive housing. That's kind of under these services.
There is very limited assistance specifically under Medicaid HARP, but it's really just somebody helping you to fill out like the 2010E. It's not as active and hands-on as really the community needs.
Okay. All right. I know there are some other questions in the chat, and I'm going to keep track of those to the best of my ability, but I think some of the questions may also be answered as we keep going in the presentation. So I think we can go on, and I will again continue keeping track of questions.
Great, thanks, Clara. Okay, so next we're going to talk about a type of managed care plan called a Medicaid Health and Recovery Plan, also known as a HARP, H-A-R-P. So what is Medicaid HARP? It is basically the same thing as what we just talked about, but it has added additional mental health and substance use support benefits. So it's still a public health insurance program. It's still funded by the federal government and the state government and local counties. The federal government still oversees and sets rules for this, and it's still administered by the state government and local counties, just like what's called mainstream managed care. However, there are some additional benefits. So just to kind of review, all the things that were in the managed care plan, mainstream managed care plan or fee-for-service plan are also available in Medicaid HARP, right? So it's still hospital treatments, crisis respite, physical therapy, diagnostic tests, the same list, still available. However, there's some more things available. But before we get into that, kind of the question that always comes up, obviously, is does this apply to me? So let's talk about who is eligible for Medicaid HARP. So you must qualify for Medicaid managed care, kind of through the eligibility application process we described earlier. So that'd be the first step. And then Medicaid HARP at this time is only for people who are 21 years old or over. So it's not, there's different types of services available for people who are under 21 years old. And there's a formula that the state has created that basically looks at what type of mental health support services have you used and how many and within what time frame. So you have to meet or exceed that formula. And there's 13 different like boxes to check off that have kind of like different requirements within each box. So I'm not going to go into all that level of detail, but if anybody wants to know, you can reach out to us. So there's no way to apply to be eligible. Unlike applying for Medicaid generally, you cannot apply for Medicaid HARP. The state just has this formula. They look at what your usage history of these different supports, and once you reach a certain threshold, then they say, okay, maybe this person can benefit from extra supports. To find out if you are eligible or possibly even already enrolled, because many people who are eligible are already enrolled and don't know it. Probably when I first started doing this work, at least half the people I spoke to who were calling to ask me whether they might have Medicaid HARP did and had no idea. And that can be for a lot of reasons. Medicaid sends out these letters that are not very user friendly, I guess I'll put it that way. And so, it may end up in the trash, or people have, the address is different than what Medicaid has on file, different things like that. So if you want to call yourself and find out for yourself, you can call New York Medicaid Choice. That's sort of like the branded name. It's also known as Maximus at 1-855-789-4277. You're going to need to have either your Medicaid ID, that number that's under the big B on your benefits card, or your Social Security number ready for the representative. When you call, it's a touch tone phone system. So they're going to ask you some questions like your date of birth and your Medicaid ID or Social Security. You have to enter all those things in, and then you end up speaking with a representative who's going to ask you all the same exact questions. When you get through kind of like that piece of things, you want to ask the representative if you are HARP eligible. Another way to say that is ask them, what is my H code? If you don't have an H code, you're not HARP eligible. If they say you're not HARP eligible, then you probably aren't unless the representative is poorly trained, which does happen sometimes. If you are HARP eligible, but you're still in your kind of mainstream managed care plan, at that point, you can ask the representative to switch you into a HARP plan. And you can stay with the same company that you're with. So let's say you have managed care through Affinity, and you don't want to go through all the trouble of figuring out how to deal with a new plan. Affinity also has a HARP plan, so you can just transition from your mainstream plan into the HARP plan and stay with Affinity as the administrator of either plan. So if you want, we can also assist you with finding out about your HARP eligibility. You can give us a call at the Urban Justice Center Mental Health Project at 646-459-3076. We don't have any like special access to information that you don't have. We would just make the phone call with you on the phone, and would be able to kind of troubleshoot if I might be able to hear that a representative is not quite giving accurate information to somebody, and be able to intervene in that case, or one of the other health advocates who are my colleagues would be able to. And if you call and you find out you're not eligible, we can still help answer your questions, understand what your kind of Medicaid is, so get clarity on like what exact type of Medicaid you have, and what that covers. I also want to note that some people in HIV special needs plans are also eligible for HARP benefits, and we can help you figure that out with that phone call as well. So what supports does HARP offer? Let's say you call, you find out you are eligible. What does that mean? So everyone in a HARP has a right to either a care coordinator or a recovery coordinator. That's just a person who explains what supports are available to you and assists with going through whatever the required steps are to get those supports set up. So that individual meets with you, either virtually or in a place of your choosing, and asks you kind of like, what are your recovery goals? And then can discuss together, what types of services might be beneficial, might you be interested in trying to move towards those recovery goals. The difference between a care coordinator and a recovery coordinator is, for a care coordinator, you have to enroll into a health home. Some of you may be familiar with health homes, maybe not. It's not named terribly well because it's not a place that you live. It's just a place where that has an agency that helps you get the care and services you need. So a health home would employ care coordinators, and the care coordinator would meet with you. Some people already have somebody in their life that helps them coordinate things, but it's not part of a health home. Those folks might have the person that helps them instead be certified to be a recovery coordinator. So it's the role is the same. It's just kind of like if you're already working with somebody, you don't want to give that person up. You have a good relationship. There's a way for that person potentially to be your coordinator. So let's say you don't have a coordinator yet. You're not sure, you just found out you're eligible, or you're not working with anybody. You can call your plan's member services department, again, on the back of that plan card. So not the benefits card, but the plan card, and ask to be connected with a HARP care coordinator or a HARP recovery coordinator. So that's one way to go about it. I will give a fair warning that oftentimes when I have called member services departments, the member services rep does not know what a HARP coordinator is. And so it can be a very frustrating call that also involves going through a lot of automated lines before you finally talk to a human being. So you might want to put aside, a good 45 minutes for that call. The other way that you can get connected with a health home is to look up the health homes in your county. And I have a link here in the slides that you can click on when we send the slides out, that directs you to a page where you can, by county, look up the health homes in your county. And when you call them, they will know what a HARP coordinator is, and they will be able to start that intake process with you. A third option is you can call us at the Urban Justice Center, and we will assist. And again, we don't have access to any systems that you don't have access to, but we can help make that phone call to the member services plan. We can help you look up the health home in your county. Let's say you don't have internet access where you're at. That's things we can look up for you and assist you with. Okay, so now you have your care coordinator all set up. What supports can you get in addition to the care coordinator? There are 2 different systems of supports. This is new. They just started doing this February 1st. I'm going to go through these a little bit quickly. There's a lot of detail that can be gotten into, like each of these types of supports could be a training on its own. And so I recommend, if there's questions, I'm happy to answer what I can. But just to let you know, that's going to be kind of a lot of information. So authorized medically necessary supports, again, that's always the key with any Medicaid service. There's a group of supports that they call behavioral health, home, and community-based services. There are 4 types of services that fit into this category. There is habilitation, education support services or pre-vocational services, transitional, intensive, or ongoing supported employment, and non-medical transportation. So what is habilitation? Broadly speaking, it's there to assist you with developing skills necessary for remaining in community and pursuing your recovery goals. So some examples are, if you need assistance with how to use transportation services, assistance with managing money, managing traumas, or securing TTY services. These are all considered habilitation, and somebody would work with you to develop those skills so that you're able to get the services that you're going after. There are also education support services or pre-vocational services, and this is formal training or school with the goal of achieving skills necessary for employment. Some folks might be familiar with Access VR. That's an example of an organization that provides those services. There is also transitional, intensive, or ongoing supported employment. So these are sort of different levels of support that build you towards the goal of achieving or maintaining employment at or above minimum wage. And there's also non-medical transportation. So this one is pretty unique to Medicaid HARP. It's a free transportation to destinations related to a goal in your plan of care. So for example, if you need to get to a job interview, that normally would not be covered by Medicaid if you need transportation services for that. However, if it's connected to your kind of recovery goals, then you can apply for non-medical transportation, and Medicaid will cover your transportation from your home or wherever you are at. I think there's some mileage limits, but to your job interview, college fare, like a GED prep class, things like that. So there is a second group of supports called CORE, that stands for Community Empowerment and Recovery. These supports aren't new, but the way that they're being administered is new, and it's kind of a dual system that they have going on now. These supports are available where you live, where you work, where you learn, socialize. It's meant to be mobile support, so it's meant to meet you where you're at. You don't go to a clinic for these. The person comes to you. In some cases, you can get them through telehealth, and there's meant to be a no wrong door referral process. So, for example, you don't have to get an eligibility assessment, you don't need to join a health home, and you do not need to visit your primary care physician or work with a care coordinator to get these supports. Like, you can just go ask for them yourself if you have Medicaid HARP. These supports are empowerment services, peer support, family support and training, psychosocial rehabilitation, and community psychiatric support and treatment. So peer support is, and there may be probably some peers on the line with us today, it's getting help from somebody who knows what you're going through, they've been through it themselves, and they've been through a training program and are certified. Family support and training is family of your choice. So this can be people you live with, it can be friends, it can be relatives, mentors, whomever you choose to call family, can be involved in your recovery. So for example, if you, for example, a client may have, an individual may be a person with mental health concerns. Maybe they live with their parents and there's some, maybe tension or et cetera between them in the relationship. And an individual can come in and kind of do some training around like better ways of communication or, whatever supports the individual is looking for in terms of that familial relationship. And again, it can be anybody that you call family. It's their family of choice. It does not need to be biological family. Psychosocial rehabilitation. This is a very broad array of services, and I could do like an hour training on just these. So broadly speaking, it's about helping you improve your life satisfaction and wellness as you define it, want it, and need it. And then community psychiatric support and treatment is support by clinical professionals. So this is meant to address barriers that impact daily living, such as housing, finances, education, employment, personal recovery or resilience, family, and relationships. So kind of just to repeat that in a visual format, there's two sets of rules for different types of HARP supports. There are the core supports. Those are peer supports, family support and training, community psychiatric support and treatment. I'm missing one. Psychosocial rehabilitation should be on there. I apologize. This requires just a simple form that the agency can set up for you. So let's say a peer services agency that you've been recommended to or you like, and you can just go to them directly if you have Medicaid HARP and say, I want these services, and then they will set up the process for you of how to get that service. You do not need any type of assessment form. It's meant to be very simple. Versus the behavioral health, home, and community-based services must go through a care or recovery coordinator. So you would have to go through and join that health home, get the care coordinator first. Then you have to do an assessment, and there's a lot of different steps in getting those services. And the way to get kind of access those is to call and get connected with a recovery coordinator. These are both supports that are available under Medicaid HARP. One of them has a longer process than the other, is basically the access difference between the two. So that system has a lot of steps, a lot of ins and outs. And so if you have questions about how that works, if you're stuck at some step and you're trying to access HARP services, you can contact us at the Urban Justice Center, and we'll be happy to, address, if it's a question, if it's a complaint about something, whatever it is, to the best of our ability, and, consult with colleagues when we don't have the answer. So our phone number again is 646-459-3076. And I will pause here. We have about 15 minutes for questions and clarifications and feedback.
Awesome. Yes, we have a bunch of questions. One quick question to start off with, since you shared the number again for the Mental Health Project, what are the best days and times to reach that number provided?
Yeah, good question. You can call anytime. It's actually a warm line, so you'll get our voicemail. So you can call if if it occurs to you at 3 in the morning that you want to speak to us, you can call us at 3 in the morning and leave us a voicemail.
Cool. Okay, a couple of quick questions. Is HARP available in all states?
No, HARP is specific to New York.
That's what I thought. Okay. As providers, do providers need any additional certifications to assist clients that are HARP eligible?
It depends on the type of provider. So for example, a primary care physician giving you a referral to something, no. But there are designated providers. I wouldn't know who they are off the top of my head, but if somebody has a question about their specific provider, I would recommend contact your provider and ask them if they are able to. And if you run into kind of like problems with them not even being sure, you can always call our office.
Okay. And if somebody has assisted outpatient treatment via Kendra's law, do they automatically qualify for HARP?
That I don't know off the top of my head, but I could certainly look it up. If somebody wants to reach out to us after the presentation, I can look it up for you.
Cool. Okay, then we've also got, oh, and another quick question, actually. Can you clarify if parents of adolescents or children with Medicaid can use HARP for their kids?
No, it would have to be the individual themselves as the person with the Medicaid plan. So yeah, it has to be the individual themselves, not you wouldn't be able to apply it to a family member or a loved one.
Cool. Okay, so thank you. That's most, I think, of the quick questions. Couple of broader questions. Okay, in terms of the algorithm and qualification, is there any way that you can share the algorithm or sort of a summary of the algorithm, or is there a way to sort of do that? Yeah.
Yeah, I can certainly do that. Do you want me to, it'll take me like a little minute to find that on my computer. I could do a screen share right now, but maybe we kind of pause on that and get through some of the other questions if that's helpful.
Yeah.
I can also send it out after the presentation to you, and then if you want to disseminate it to the registrant list, I'd be happy to do that.
Yeah, that might be, I mean, we are going, just so folks know, in addition to sending out the slides and the recording, we're going to be sending out, a number of additional resources. I know some folks mentioned that there were some great resources being shared in the chat, and we're also going to share things like this are great to send out via email afterwards. So I think that's a great solution. Yeah, so in relation to that as well, someone mentioned that they were told by someone at the Urban Justice Center that it's possible for a medical professional to certify the medical necessity of HARP services, even if you don't qualify. And they were wondering if they could get more advice in that, on how to sort of do that kind of advocacy or self-advocacy.
That's not quite true. So the way that it works is, if you, for example, are looking to get a home health aide, or you're looking to increase your home health aide hours, you would contact your Medicaid managed care plan, ask them for that. They do an assessment, and then let's say you get, 4 hours, but what you really need is 8. Then, if you've asked for the 8 hours and they give you 4, they send you something called an initial adverse determination, and it would say, we found this not to be medically necessary. We're giving you 4 hours and not 8. Then you can appeal that immediately to the plan itself. And this is something you have to do. It's a required step. And then let's say they just have the same finding again. They'll give you something called a final adverse determination. At that point, you have an option to file a fair hearing with the Office of Temporary Disability Assistance and or file an external appeal. When you file an external appeal, there is a doctor or maybe a team of doctors that looks at the case, and they're meant to be outside of the plan. So they're supposed to be neutral, but it's not going to be your doctor. It's a something that, you know, Medicaid has set up outside of your personal doctor. If you file a fair hearing, then an administrative law judge will look at whatever evidence is presented to the administrative law judge and decide whether or not the plan was correct or whether you were correct. In the process of both of those, you can get letters of support from your physician that state, you know, this is medically necessary and here's why, and that's definitely recommended, but it's not that your doctor is going to be able to determine it or not. It's a supportive documentation for a different deciding body.
Cool. Okay. I hope that addresses that question. Similarly, so somebody else had said they talked to New York State Medicaid about HARP and got the information that they were backlogged, but that a PCP may refer someone to initiate the process, but the PCP is uninformed and the affiliated social worker. So they're sort of facing this predicament of like no one who is supposed to be able to help get them into these services knows how to do that. And they also mentioned, which I definitely want to highlight and validate, they're feeling very, like the whole process is just very, they use the phrase epistemically violent and impersonal, and sort of struggling with that. So I wonder if you could speak a little bit about that.
Yeah, no, I'm really sorry you're going through that. It unfortunately is super common. There's a lot of systemic problems with this whole system. Many people are very frustrated. In fact, only something like 5% of eligible people are actually getting the services, which is why we started Access to Recovery, which I'll talk about in a little bit. But your PCP doesn't really have anything to do with you getting your HARP services. What I would recommend is you can call our office and we can figure out exactly what the stuck point is and advocate to get unstuck. But it's extremely common and it is very dehumanizing. And it's very common for people to get wrong information told to them very confidently. I see this all the time.
Yeah, absolutely. There was some discussion in the chat as well about HARP versus PROS. Can you talk a little bit about the difference between HARP and PROS?
You don't need HARP to have PROS services, but in order to get kind of the details, I would have to pull up some documentation. So what I would say is I can provide some information after that you can share with the community. So I'm just taking a little note here to make sure I got.
I see the thumbs up. Thank you. Cool. Okay, there's also someone, again, with a more general question that was interested in your experience particularly, and in how you're able to, how they or one in general would be able to have employment and retain Medicaid. They say Medicaid's been really useful for me. The services provided have lowered a lot of stress by paying for everything and streamlining services, so I don't have to do all the coordination for care myself, but I also need money and work. So how do I move towards, how do I sort of do that if I'm maybe moving towards the income limits and resource limits while still retaining services? And somebody in the chat had mentioned a resource, which I'm trying to go back and find, which I just want to say it out loud so people, there we go, Medicaid buy-in for working people. But I don't know if you wanted to share any additional resources regarding that.
Yeah, there's so the Medicaid buy-in for working people with disabilities program does have a higher income limit, and I don't remember off the top of my head what the resources limit is, than does, you know, your sort of Magi or non-Magi Medicaid. In other words, like the sort of more common ways that people are eligible for Medicaid. Our office would be able to depending on where you're geographically located, be able to assist you with figuring out if you're eligible for a Medicaid buy-in for working people with disabilities. And the other option is something called a spend down, which is broadly stated, placing some of your income into a special needs trust so that it's sort of in legal terms hidden from the Medicaid calculations. And there's limits on that too, and it gets pretty detailed. So if there's questions about that specific situation, give our office a call.
Cool. Somebody had also asked, can folks who are out, I suspect that since HARP doesn't apply outside of New York State, the answer to this is no, but someone was asking if they could call your office from out of state, if that would be useful.
So if you live in a different state and you call our office for Medicaid information, we can help you figure out if there's somebody in your state to call, because Medicaid is so state specific. And also I'm not licensed to practice in any other state. I would not be able to give you legal advice out from anything outside of New York, but we would work to try to find if there's another legal services agency in your state.
Cool. Someone had also, since you mentioned some of those, the special needs trusts and all of that, somebody had asked if you could go over ABLE accounts and Medicaid. I don't know if that's too broad of a question, but that was asked.
That is something I myself am still figuring out. So that's a great question that I don't know the answer to. But I'm working on it myself. I have a few individuals right now that I'm trying to sort out kind of the best, is it an ABLE account? Is it a special needs trust? Is it what kind of thing is best?
Cool. Awesome. Okay, let's see if there are other. Does HARP assist or cover senior living or things for aging parents with health and with mental health issues?
So I'm not sure what you mean by senior living. Can you say more about that? Whomever asked.
That's I think we have a second. If that LeVar McCline had asked that question, and we can, if you would like to raise your hand, we can unmute yourself if you want to elaborate on that. A parent is in a facility covered by Medicaid.
So no, Medicaid HARP is specifically meant to keep people out of facilities and institutions such as hospitals, jails, and nursing homes. So at the point where somebody is in, a nursing home or is living someplace that's not in the community, they would no longer be eligible for Medicaid HARP, which is not to say that there's not mental health services available for people, because there are. It just wouldn't be through this particular program.
Got it. Cool. They say thank you.
No problem.
So there is also a, again, a fairly specific situation, but I think may have some broader applicability because there are a lot of providers on the call. Someone was asking the case manager in their program was going to refer a client for health home coordination, and the client was apparently assigned to a HARP care coordinator, but the provider who's asking the question doesn't know how to reach the worker, and the client didn't know he had one. And so they're trying to figure out how they can find out more.
Yes, that also is unfortunately super common. So a lot of the care coordinators have very high caseloads and receive inconsistent training. So the kind of the quality of care coordination that a person may receive varies quite a bit. So if in a situation like that, what you can do is call the member services number on the back of your card, ask them what health home the individual is assigned to, and then you can call the health home directly and see where they're at in the process. Have they been actually assigned to somebody? Did they get assigned to somebody and then that person, quit or no longer works there, and the case is just sort of floating between workers right now?
Got it. Great. I think cool. I know we want to do our last section, so maybe we will have another opportunity for questions at the end, but I think that's a great moment to go on. And again, if I haven't gotten to your question yet, or it's possible I've missed it, so please do feel free to kind of keep putting questions in the chat. And yeah.
Okay, great. Thanks. Those are all really good questions, everybody. Thank you for participating. I appreciate it. Okay, so with all the problems that we just discussed, all the kind of like dehumanizing things, wrong information, you're supposed to have a care coordinator, but you've never heard from them and don't know how to get a hold of them. These are things that obviously can be worked on an individual level, and that's what people, need is like kind of, let me get my things solved. But they are signs of systemic failure. This system really doesn't work the way it's meant to. Like, it looks very nice on paper, and then in reality, it's been, I think saying a disaster is maybe a little strong, but some people do feel that way. And so, we were kind of a couple of years back, I was seeing like the same issues over and over and over again. And kind of the way I think about things is, why is this happening? People shouldn't have to go through all this, particularly people who may be in crisis or in, need recovery support. And so we applied for a grant to work on systemic change through the Vanna Marengen Foundation. And we're fortunate to receive a 3-year grant that was just recently extended for a 4th year to build a coalition of directly impacted people, meaning people who themselves have tried to access Medicaid HARP and had problems with it, or their loved ones or people who support them. Peers, meaning folks who are either certified or not, kind of using that term very broadly, and providers, such as the provider we just had on the call, who's trying to figure out how to get, how do I get my client connected with these services when there's like this massive gap. And the point of this kind of coalition that we've built is to change how this works systemically and really bring the voice of directly impacted people higher up in the decision-making process, so that the state is being informed by people who know what's going on, where all the problems are, and can help shift how these things are kind of disseminated down and have it be of more of an even playing field than it is currently. So we really are very specifically working on Medicaid HARPs and HIV special need plans. There's a lot of things in Medicaid that need change, but that's really the area we focus on. It's a project of the Urban Justice Center, and it's built on a nothing about us without us value system. So a lot of these decisions about how these systems function have been very top down. I've attended a lot of trainings that are supposed to be for like care coordinators or providers or whoever. It's an extremely technical language and not very accessible, even to me, who's like living and breathing this world every day for a job, right? Let alone, somebody who is trying to sort through all the misinformation, et cetera. So we have been meeting, we started before the pandemic. We've been meeting since about, I want to say, October of 2019 or so. We meet the first Thursday of every month. We respectfully and kindly ask that people who work for the government do not come to our meetings. So if you work for Department of Health, OMH, DOHMH, a local governmental unit, this meeting really is not for you. It's really for people who are trying to access these systems from a more on the ground, like grassroots level. We do these all virtually. You can attend, it's just like attending today. You would attend by Zoom with video or phone, whatever works for you. And we have a low volume listserv. That's how you kind of register for our meetings, is to join the low volume listserv. It's really just an announcements listserv. Maybe 1 or 2, it's probably not true, probably 2 or 3 emails a month. So what have we done? We just recently negotiated with OMH to bring a town hall / training about the new core services that was led by peers and was meant to be for peers statewide with OMH. So we did 3 town halls. We had a couple hundred people attend, and the slides were all, looked at by peers and evaluated, like, what language should we use? Is this accessible? How do we talk about these things? What questions do people have? And it was really meant to be a place where people can kind of like speak out and say, okay, well, that's nice, but here's a huge problem. So for example, in the town hall, people are really angry about the algorithm. Like, why should people have to be in crisis before they have access to these services? Why aren't these just available for everybody? So that's one of the big projects we just finished up. And the direction of the coalition is whomever shows up has a voice. So I'm really just a facilitator for the coalition, but it's the people who are in the room who decide what we do. So I would love to see some of you all there at our next meeting, which is Thursday, March 3rd. And I have information about how to join, or if you just have questions about what we do. We have a pretty short, that's kind of like all I had to say about the coalition at this time, but I want to open it back up for any questions about the coalition or anything else that has come up today.
All right, I think we're going to give folks a minute to kind of
Process a little bit, yeah.
process that. I think maybe while folks are sort of figuring out if they have additional questions, well, maybe somebody did ask how they can register for the coalition. So maybe if you want to specify that.
Yes, so I send out registration links through our listserv. I usually do that at the latest a week before the meetings. I try to do it earlier than that. So if you want to join our listserv, you can just email me directly at go back here. Sorry, I should have put that on the slide when we're talking about. Aha. So here's my direct contact information. You can email me directly or call me directly, and I can add you to the listserv, or you can just email that HARP.
Yes,
HARP at urbanjustice.org.
Great.
You can also, I can also add you, if you just want to check out one meeting and don't want to be on the listserv, just give me a call and I'll add you that way as well. But it's just the most consistent way for me to keep track of, I get a lot of different emails and I just want to make sure I'm not missing somebody on accident and that you don't get left out on accident.
Perfect. Oh, where did I go? Okay, cool. Great. Okay, so there is somebody whose hand is raised. So I think we have a moment to.
Oh, Phil.
Oh, sure. Yeah. Oh, yes. I think they said that they were.
Phil is a fantastic member of Access to Recovery. I'm excited he's here today.
Perfect. So you should be able to unmute.
Yeah. Hello. Hi, everyone. Yeah. So actually, this week will mark 1 year since I joined Access to Recovery Coalition. So I just want to mention that I think there might be other members in the room. That are part of H2R. I'm not sure. But yeah, this has been being part of this coalition has been awesome for me, and I just want to thank the Urban Justice Center Mental Health Project for getting this off the ground. It helped me to provide a voice for myself as a person who's been directly impacted by these services. So I just want to give that shout out.
Thank you so much. Yeah, awesome. There was thank you for being here. And it sounds like there's a bunch of people that are interested in joining, at least joining the listserv, maybe coming to a meeting. So, Frankie, maybe we can also include your contact information in the follow-up email so that folks can reach out to you.
Yeah, definitely. That's certainly welcome. And if you email that HARP at urbanjustice.org, there's somebody who kind of looks at it and sorts it, but anything that, like that would go to me anyway. So if it's easier for you to remember HARP at urbanjustice.org, or just easier to spell, because my last name has these double consonants that like my whole life people always like forget one. So yeah, if that's whichever way is easiest for you, you can call, you can email either of those email addresses, and I'll make sure that my contact information goes out with Clara.
Awesome. Okay, a couple other questions just about eligibility. Do you have to have SSI or SSDI to access HARP? And does prior inpatient hospitalization impact whether you qualify?
You do not have to have SSI, SSDI, and prior inpatient hospitalization does impact. It is part of the algorithm that I'll send out, and you can kind of look at those examples.
Yeah. Somebody did ask, and I know you mentioned core, but somebody did say they were under the impression that HARP was going to change in 2022. And so just they were wondering if you can give a little more info about that.
Yeah, so all of the services used to, 100% of them used to be under the BHHCBS, the Behavioral Health Home and Community-Based Services. They were all under that legal framework. It's a federal framework that, you know, the state is obligated to follow certain rules and procedures, which is some of why it's so cumbersome. And OMH and DOH have been working with the federal government to shift as many of those services out of that federal framework as possible to make it easier for people to access. So the core services are the ones that they were able to shift out of that framework to make it easier. And the ones that remained are the ones that for whatever laws, regulations, reasons, they were not able to. So the services themselves should not have changed much in theory. We'll see how this actually plays out. But the way to access it in theory is easier for those core services.
Cool. And okay, yeah, so that's that question. There was also a question, which I suspect the answer is going, and I provided the person with the mental health project number to call, because I suspect that's going to be part of your answer, but was somebody who was asking how to get Medicaid to help pay for an out-of-network psychiatrist, because they were not able to find anyone who was in network who had availability and was comfortable with the specific level of care that the person needed.
So they try never to pay for anybody out of network. I'll just say that to start. That's something they never want to do. So it is going to be a difficult road, but fundamentally, the person has to have a specialty that the individual absolutely needs, and that there is no other person in network that can provide it. So it can't just be like, and you know, this, I don't agree with the way this is set up, but it's true. It can't just be like, oh, I don't get along with this person. It's really more about their specialty services as opposed to the individual, you know, relationship with the service provider. So it has to, you know, for example, you know, if somebody wants, I don't know, like a really particular psychiatric, like if somebody wants like assistance with dealing with anorexia, and they, in their network, there's not a single provider that is a specialist in anorexia, then they might be able to get an out-of-network provider because there's no specialist. But if there's 5 specialists that deal with anorexia, however, you know, that person, you know, just doesn't like have availability, then maybe it depends on how severe it is. Like I would say that's the kind of thing you want to call and talk to an advocate and get kind of more situation-specific details.
For sure. Yeah. Yes. And I did the numbers up on the slides, and I put it in the chat. You know what? I'll just put it in the chat again. Can't hurt. Cool. So I actually don't, that's all the questions that I have in my kind of question bank. So if there are other questions that folks would like to, oh, we can see everybody now, yay. If there's, other questions that folks have, or if anybody would, again, like to raise their hand and ask a question, we still have about 10 minutes before we're going to wrap up. So we'd love to take some more questions and feedback. And when I say raise hand, I can't see everybody. So you would have to, I mean, in the, with using the Zoom raise hand function. Cool. Oh, interesting. Okay, this is a great question. Just going off of your just discussion of like a specialist. Is there any criteria for what defines a specialist for trauma? Because this person there, and I think I've also experienced this, there's many people who may say that they have expertise in trauma, but they're not actually in possession of the tools to support managing trauma, and particularly complex trauma.
That's a really good question, and I don't know the answer off the top of my head. But it's the sort of thing we could research, though.
Yeah. All right, and we've got 2 questions. I'm gonna start, I believe, Donham, I'm gonna start with you. You should see a little pop-up that says the host is asking you to unmute. Let's try that. Potentially, Donham is not there. I also see Laura Ann, so I'm gonna ask you to unmute if you'd like to ask your question.
Hi.
Hi.
Hello.
I will be turning 65 this year, and I understand that means I can't think of it. HARP will end. What happens to me after that? Is there anything else I can do that's similar to this program?
That is a great question, Laura, and also hi.
Hi.
So the state has been trying to figure out ways to continue HARP services for individuals who turn 65 and become Medicare eligible or dually eligible. The dates on those keep getting shifted around, so I don't know off the top of my head like what that looks like. But depending on the specific services you're interested in, possibly, because there's Medicaid HARP has a lot of services that there's other pathways to access them. So I would say we can, give me a call and we can talk about your specific situation.
Okay, thank you. Let me
Okay.
put my hand down.
Another question. Do you see challenges with folks obtaining mental health services specifically? And is there any specific guidance on understanding and obtaining mental health resources with Medicaid?
Do I see challenges? Yes, many, all the time. I mean, I wish there was some like magic guide, but I don't think there is. Like, I think it's just like trying to find a primary care physician that meets your needs. It's kind of just a matter of somewhat luck. And then, meeting with the person and figuring out like, is this somebody who gets me? Is this somebody who I feel safe around? Is this somebody I trust? And sometimes it takes a couple of bad fits before a good fit is found. So I would say, particularly like in areas with fewer providers, more upstate or rural areas, it can be challenging because there may be a limited pool of people that you have access to.
Yeah, absolutely. There's a lot of Frankie, I just want to share, there's a bunch of people saying thank you and expressing appreciation in the chat. I know you can't see that, so just want to express that. Okay.
My pleasure. Oh, we're saving the chat though too, right, for people's questions and
yes.
follow up. Okay.
Yeah, we're gonna save the chat for sure. There's been a ton of
resources,
questions. Yeah, resources and information shared. And I do, this was mentioned in the chat, but I do want to repeat it verbally. If anybody wants to save the chat themselves and not wait for us to send the resources, if you go to the little box where you would type in your chat and go to the 3 dots at the top right-hand corner of that little window, there should be an option to save the chat, and it will just save it as a text file. Okay, Jerry, I see you've got your hand up. Oh, yes.
Hi, thank you.
Hi, Jerry.
Hi, so I work at the Robert Louis Stevenson School, which is a high school that's dedicated exclusively to emotionally complex children. And many of our parents often struggle when their children, when they have Medicaid and their children have Medicaid. So these are adolescent aged kids. Do you have experience in your office working specifically with adolescents to provide various kinds of mental health support, and sometimes including an in-home visit?
So no, unfortunately, we don't. We really focus on the Medicaid adult population, and we don't have particular experience with people who are under 21. But I would recommend maybe reaching out to, there's an organization that's a statewide coalition called the Medicaid Matters New York. And they don't do, it's not that they do individual representation or anything. They don't, it's a coalition of a bunch of different people who care about Medicaid and want it to work better for everybody, but they may have some resources for you if you want to reach out. And I can include that in the information that or you could, if you want to just kind of look it up in a search engine, it should pop up, but I'll include that in the information that I send out to Clara as well.
Much appreciated, thanks.
No problem. There are certainly parents of people who are in systems that you're talking about in that group. I also did pull up the, while we were chatting, I pulled up the algorithm. If we want to just see some examples of that, there seem to be a couple questions about that.
Absolutely, I think that's
Give me a second here if I share my screen. Okay, folks can see this?
Can folks see this okay?
It's like a PDF document with like a grid, and it says criteria at the top and etc.
Yep. All right. We've got a bunch of yeses and some
okay, great.
Up. Amazing.
So HARP eligibility, here's the criteria. This is criteria as of, I think, 2018. The only thing that might be shifting here is this Medicaid, Medicare enrolled duals thing that's going through some transitions. But so in order to qualify at all, eligible at all, first you have to pass these targeting criteria. To be 21 and over, Medicaid enrolled, you must have, in their language, a serious mental illness or a substance use disorder diagnosis. You must be eligible to be enrolled in a mainstream managed care organization. So that mainstream managed care we talked about before, Medicaid managed care, as opposed to fee for service. And for now, not dually eligible. And also cannot be participating or enrolled in a program for the with the Office for People with Developmental Disabilities. I don't know exactly why that is. Might be like some bureaucratic legalese there that for some reason that group is excluded, even though obviously there are people with overlapping health conditions. Okay, so once you get kind of past all those threshold requirements, you've ticked all those boxes, then you have to meet at least one of these set of risk factors. So one example is you have to be on SSI and have received an organized mental health service in the year prior to enrollment. And I have a definition for organized down here somewhere, but I'm not going to get into that right now. Okay. Or you have to be somebody who does not have SSI, but you do have 3 or more months of assertive community treatment, also known as ACT, or targeted case management, also known as TCM, or personalized recovery-oriented services, known as PROS, or a prepaid mental health plan services in the year prior to enrollment. So you can see it gets pretty dense, like these different layers, and there's 13 of them. So for example, people with and without SSI who have 3 or more psychiatric inpatient admissions in the 3 years prior to enrollment. So if there's ever a question, let's say you call up and they say you're not eligible and you're like, that doesn't seem right. I feel like I should be. Our office can also help with those type of situations. I did successfully win a fair hearing for somebody who, to our mind, reading through this list, clearly should have been HARP eligible, but was not marked as such, and it was some type of administrative error. So that's also something that we can assist with. And I'll send this list out so folks can kind of take a look at it on their own time without me like scrolling through maybe too fast. So we are at
Amazing.
3:30.
Yeah, we are at 3:30, and it looks like yeah, we've managed to get through a lot of information. So really appreciate the folks that are still here. Frankie, really appreciate you for just being so clear. There were a lot of compliments specifically to the clarity and comprehensiveness of your presentation. Yeah, so really appreciate all of you being here. We are, as aforementioned, going to send out the slides, send out the recording, send out the algorithm that we were just looking at, and send additional resources. That email will go to the email that you registered with. But you can reply to any of those emails that you get, and it will go to me. And if you have any questions or anything in addition that you are looking for, please feel free to ask. Thank you so much to our ASL interpreters as well as our Spanish interpreter. And yeah, thank you all so much for joining us. Thank you all so much. I'm going to go ahead and save the chat as well, just to make sure we've got that. And yeah, have a great rest of your day, everybody. And thank you all for being here.
All right, thank you all. Bye-bye.